Good morning, guys. Hello from me. Hello from Dexter. Hello, Dex. We've had a busy week. Our last patient was from Pakistan. Can you believe that? He traveled 8 hours. He quarantined for 10 days just to come to the men's health clinic. Pretty impressive, isn't it? Wow. Quite humbled, really. I suppose it goes to show how bad the level of care is in Pakistan, and hopefully how good the perceived level of care is at the men's health clinic. So as part of everybody's new patient TRT consultation, I counsel them as to what to expect. What should you expect? Well, it kind of depends on where you've come from and where you expect to be. So you may be suicidal, you may have low mood, anxiety, depersonalization, you may be shattered all the time, you may have brain fog, you may just want to get your leg over. So the premise behind TRT is literally normalization of your male androgen levels. To do that, we utilize HCG, which mimics luteinizing hormone, and testosterone cypionate. We microdose a small daily subcutaneous injection of both hormones to mimic the diurnal variation that happens naturally. As we said before, every day is a new opportunity. So we want stability, we want balance, we want to mimic natural physiology. There is a process though that you have to go through. It is unavoidable. Now, pharmacokinetics, it takes 5 half-lives for the HCG to stabilize, and it also takes 5 half-lives for the testosterone to stabilize. We then need to adjust the protocol according to effect. Your physiology will change as a result of giving exogenous hormones. So what should you expect, hopefully, from the HCG? Well, you are going to stimulate natural intratesticular production of testosterone. But the normal changes that occur within the first couple of weeks are not because of that. They are because of activation of this, the neurosteroids. There are LH receptors in the brain, so you will hopefully feel a sense of well-being, potentially a little tingle, an improvement in your libido, perhaps a clearing of your brain fog. You may feel absolutely nothing. Disappointingly, you may feel a level of anxiety that you did not feel pre-TRT. What can you do about that? Nothing. What I want you to do is just understand the process and appreciate the process. It's likely that your senses are slightly dulled as a result of low testosterone. So just enjoy the ride, whether it be negative or positive, because you are not going to be stable for at least 6 to 8 weeks. And it's likely after that that there will be a titration process to achieve a healthy testosterone to estradiol to DHT ratio. Your physiology will adapt, it will change to the use of these exogenous hormones. So go with the flow, baby. So the HCG takes around 11 days to stabilize, the testosterone between 4 and 8. What should you expect from the testosterone? Now, hopefully you do have some natural testosterone production. That will be suppressed. The testosterone will then peak and trough, peak and trough, peak and trough, peak and trough, peak and trough until you achieve stability. So when you start TRT, your immediate assumption is I'm going to reverse all of the negative symptoms that I presented with. We aim to do that 100%. But the laws of pharmacokinetics and pharmacodynamics mean that there will be fluctuations in your hormone levels. that change in physiology can and likely will manifest as psychological symptoms. So enjoy the ride. It is what it is. If you've come to the Men's Health Clinic, you are microdosing. So this is the most effective way of achieving stable male androgen levels and not disrupting your physiology. Big doses cause a drop in SHBG, and then essentially you play catch up constantly. What we don't want to do is distort physiology and over sensitize the aromatase enzyme and create an abnormal ratio of testosterone to estradiol, because that can manifest as anxiety. We don't like anxiety. We want balance and stability. So do not create dramatic change. Your body paradoxically would like to be either low or high compared to fluctuating. Just look at the female menstrual cycle and the physiological impact and subsequent psychological impact of these changes in the hormone levels. They are unavoidable. So these fluctuations are not truly reflective of a stable, balanced protocol. So as Felix said in the last video, an increase in testosterone can cause an increase in dopamine. And we like dopamine. Dopamine is the pleasure chemical, but it's not necessarily reflective of your true natural state. As said before in numerous videos, testosterone, DHT, and estradiol are your foundation hormones. They allow you to achieve the reward hormones. So this first part of your journey is not necessarily reflective of your true state. Is that disappointing if you've had a really good ride? Well, it can be, but sort it out. How should you feel when you wake up? Hopefully refreshed, motivated, with lots of drive and determination to do what? To go seek those reward hormones voluntarily. So physically, what should you expect? Well, you're obviously affecting this and affecting this. So with suppression of your natural endogenous testosterone production, you may see some testicular shrinkage. Even with HCG, there will be some fluctuations over the first 2 to 3 months as your body gets acclimatized and accustomed to what? The drugs that you are giving yourself exogenously. Whilst we use HCG to mimic luteinizing hormone, it is likely that if you do have functioning testicles, there may be some fluctuations in the first 2 to 3 months. However, this should stabilize as the drug levels stabilize. So some testicular shrinkage, some testicular growth, some testicular discomfort. It should all settle down with time. So trust the process. What else should you expect? Well, as we've already said, hopefully reversal of these negative symptoms that you presented with. If you've achieved stable DHT to testosterone to estrogen ratios, that's job done from my perspective. However, I need to give you a realistic expectation of what is normal. To achieve what you want to achieve, these reward hormones, everything needs to be in check. So good texture, good sleep hygiene, reducing stress. As I've said before, we are physical beings in a world of psychological stress. Your body does not appreciate the difference between psychological and physical stress. It releases the same hormones, adrenaline, noradrenaline, cortisol, and ultimately these can be destructive if you do not use them physically. If you don't eat properly, if you don't train, you need to use your biology appropriately. So what happens if you don't feel the benefits of TRT? What were you actually expecting? Were you expecting to be Superman? Well, if you're not Superman, you can't be Superman. However, when you've got low testosterone, one of the most disappointing things is you don't see the reward for your efforts. If your male androgen levels are stable and healthy, now my perfect levels are not necessarily your perfect levels. I'll tell you the range that I like most of my guys in, or where most of my guys feel best. It's between a free T of between 0.5 to 0.8. The total T is rather irrelevant, but SHBG will hopefully increase if you have low SHBG as a result of having healthy male androgen levels. What also improves SHBG? Reversal of metabolic syndrome, type 2 diabetes, and an improvement in your thyroid function that hopefully happens as a result of not only having healthy male androgen levels, hopefully you've adjusted your lifestyle, your diet and your training to improve your overall metabolic health. And so it's all part of a parcel, isn't it? You need to work on the things that you need to work on. So what else can happen? Well, one of the major side effects is a rise in HCT, your hematocrit, the red blood cells. I've done a couple of videos on this before. With microdosing, we see less of a rise in HCT than we do with less intensive injection frequencies. Why? Because we're avoiding peaks and troughs. A peak of testosterone causes a subsequent increase in erythrocytosis, and the bone marrow is told to produce red blood cells. It is an artificial state. As said before, we want to avoid negative side effects. So if you've got a healthy, balanced TRT protocol and you are having negative side effects, it is likely that you have another pathology. So when it comes to HCT, obviously the acute one's dehydration, but the more obvious one really is obstructive sleep apnea. Do not underestimate the importance of sleep in this whole process. As said before many times, your anabolic processes predominate at nighttime. You need to have good quality sleep, not only for natural testosterone production, but obviously when you're on TRT, does it matter? Well, it does actually matter, because there is both a central and peripheral component to this process. You can produce too many red blood cells. I know when my hematocrit grows too high that my protocol is too aggressive for my physiology, because obviously with microdosing I'm lovely and balanced. However, inactivity led to a rise in my hematocrit, which would not normally occur when I'm hitting the gym. So I had to donate blood and actually decrease my testosterone dose, because my levels were running too high and my physiology was telling me that my levels were too high. Obviously, cardiovascular health is super important, and we place a massive emphasis on this with the promotion of lifestyle, diet, exercise, the usuals. Now we know obviously excess testosterone causes a dysregulation in your lipid profile. What happens? Well, cholesterol gets converted to pregnenolone. That cascades down to testosterone, cortisol, and aldosterone. Your cells need cholesterol. LDL takes cholesterol to the cells, and HDL takes cholesterol away from the cells. Too high levels causes dysregulation of this process. Too low levels causes dysregulation of this process. Why? Because it's all about what? It's all about balance. Achieving stability, understanding your physiology. So there's obviously one red herring, I can't remember what the phrase is now. Male pattern baldness. Am I going to lose my hair with testosterone replacement therapy? As said before, with a well-balanced TRT protocol, if you go bald on TRT, you are supposed to go bald. Why? Because we do not raise DHT above normal. Why? Because actually the mechanism of action of giving exogenous testosterone and HCG in theory gives a relative decrease in DHT, as you're not exposing the same amount of testosterone to 5-alpha reductase. So if DHT is high, testosterone is high, and we will reduce your testosterone dose to a more therapeutic level. Because we like DHT, but we don't like too much. It's good for muscles, it's good for sex. But too much, there's a link with cardiovascular disease. And it's purported that it's neurotoxic. Kind of seems a little bit absurd to say a naturally occurring chemical is neurotoxic, and then conversely, estrogen is just simply neuroprotective. Everything in excess is deleterious to your health. So getting back to the subject at hand, if you go bald on TRT, you're supposed to go bald. Do not take finasteride. Finasteride is a 5-alpha reductase inhibitor. You need DHT for muscles and sex, mood. You need 5-alpha reductase for conversion of progesterone to allopregnanolone, which then is a positive allosteric modulator for GABA, the calming neurotransmitter. So these poor guys that have post-finasteride syndrome, even with healthy levels, they don't feel good. Why? Well, it's likely that they have a decrease in stimulation of GABA. So do not use finasteride. Whilst it only if it only affects a small proportion of guys, you really don't want to be that guy. And you don't want to be monitoring your DHT levels, because guess what DHT is? A paracrine hormone. It is not reflective at tissue level. So, and as already said, GABA, GABA, GABA. We like GABA. Not too much, not too little. What is it all about? It's all about what? It's all about balance and stability, and working with your physiology to improve your psychology. So there is a journey, there is a process. You have to go with it. You have to trust your doctor. You have to trust the process. You need to work in order to achieve hormonal stability. Understand that hormonal stability is a foundation for what? For you to go get that reward.